Hi. Hello, everyone. Welcome you all to the fourth episode of the Microbiome Gazers. I am Dr. Debojyoti Dhar. I am the co-founder and director of Leucine Rich Bio, which is South Asia's first microbiome company. And the whole thought behind behind this initiative is to disseminate information, knowledge on microbiome to researchers, to doctors, to nutritionists, to students, and to everyone who is interested in this particular domain. So I welcome all the attendees who have taken pains to attend this particular webinar. Also, I would like to say that this is being streamed live on our Bugspeaks YouTube and Facebook channels. So this video will be available there as well. And this is going to be a 30 to 45 minutes session. And to all the attendees, if you have any questions, please feel free to put them on the question box on the right side of your panel. With this, I'm really happy to introduce Dr. Shabnam Das Kar. She is the functional and metabolic medicine expert currently residing in Calgary, Canada. So before we start this session, I'll hand over the microphone to our speaker, guest speaker, Dr. Shabnam Das Kar. Dr. Kar, could you please introduce yourself to the attendees?
Thank you, Debojyoti, and welcome to everybody. I'm truly honored, and it's a privilege to speak for Bugspeaks. And good evening, good morning, depending on which part of the world you're in. So I am a functional medicine doctor. Many of you probably know what that means. Some of you probably don't know. So basically, by background, I was an OBGY for more than 20 years in Mumbai. A few years ago, I did a fellowship from the American Academy of Anti-Aging Medicine and moved into functional medicine full-time. So essentially, what we do in functional medicine is instead of looking at a patient as one organ system at a time, as an OBGY has to look at the uterus, tubes, ovaries, in functional medicine, we look at the whole patient rather than, compartmentalize. And back then, so for my journey has been long, and it has involved a lot of change in my thinking, because back as an OBGY, I used to look at the gut as something that got in my way during surgery, versus now it's like, oh, this is something we need to be friends with. So that's basically my background. I live in Alberta in Canada. I have an online health and wellness company. I am a doctor from India, and I do run my medical practice through telehealth for my patients in India. So most of my patients are from India, and I can see, I think a lot of our audience today is from India. So thank you.
Right, Dr. Kar. In fact, we have our audience from all from different parts of the world. So it's really a global kind of a session right now. And thanks to you for accepting our invite to be part of this series. As I said, the whole idea is to share the knowledge, expertise, and bring people together and understand the domain, because microbiome domain is quite hot. People are talking about it. So it's imperative that we all in this domain work together and share whatever information, knowledge we have. So let me start this session by asking you a very fundamental question. So what are the factors, according to you, which affect the gut microbiome? If you could share some.
So thank you, Debojyoti. I will take the help point because that's how I function better. Okay. So basically, before answering your question, I just want to clarify a little bit about what is the microbiome and microbiota. I'm sure you've covered that in your previous videos, but just a recap. So basically, these are bacteria, viruses, parasites, fungi that are present in different parts of our body. And right now we focus more on the bacteria, and particularly the gut bacteria, because a lot of the research is on the gut bacteria. But we have bacteria, viruses, parasites, so all these different kinds of microorganisms in many parts of the body. And as a former OBGY, it was very surprising to me that there was all these different microbes, even in the uterus and the placenta, because those two places we used to say that those are like sacrosanct, they are absolutely sterile, and it turns out that they are not. So there's a lot of exciting information there. So microbiome is essentially the genetic material of all these microbes, which are also included in the microbiome, whereas microbiota is without the genetic material. The interesting thing is human genes interact with the microbe genes. So that is where it is so fascinating. So that is just a basic little bit of, stuff. So what is the human microbiome? As you can see from this image, and like I said, it is there everywhere. But right now, our focus is more on the gut because there has been a lot more studies. And finally, I think we'll have to, become more knowledgeable about the virome and the parasites and the fungi and everything. So now before I move on to what the functions are, so what are the factors that influence the gut microbiome? As you can see on this PowerPoint slide, on one side, there are just 4 factors, which most of us cannot control. On the other side, there is breastfeeding, food, medications, exercise, sleep, stress, disease. Out of those, most of them we can influence. Birth mode, yes, as an OBGY, that is very important. So what do I mean by birth mode and how it decides the gut microbiome? So studies have shown that babies born by normal vaginal delivery versus those babies born by a C-section have a very different microbiome in their gut. And so the ones who are born by a normal vaginal delivery have more of the mother's microbiome, whereas those who are born through C-section also have, they have a different microbiome picture completely, which is also related to the operation theater milieu, the skin, the doctors, the nurses and everybody. And interestingly, so obviously you want to know, does it make a difference to long-term health? So some studies have shown that babies born by C-section have a higher incidence of allergy. So obviously the gut microbiome is so important for, how your immune system develops. But in respect to birth mode, so the question always arises, as clinicians, we always want to know, can I change any of this? Can I control? We are basically control freaks. So just few, I think, weeks ago, one study came out about using, capsules of the mother's vaginal microbiome after it went through, sterilized, it was checked for pathogens and all that. So there were no harmful bacteria in that. Those were given as orally to the babies who were born by C-section. And interestingly, for about 6 months, they found that the microbiome had changed to the mother's, it was reflecting more of that of a mother's vaginal microbiome. That is very interesting. Of course, there were some previous ones where they were, after the baby was born by C-section, they would smear the baby with the mother's vaginal discharge. That had also shown some benefits. So this is very interesting. Now, breastfeeding, we know that this is, as an OBGY, this is so fascinating to me. So breast milk, it changes its composition based on whether the baby was prematurely born, whether the baby was born full term at 37 plus weeks, or whether the baby was born after a normal labor versus being born by an elective C-section. So elective C-section is a planned C-section where the woman does not go into labor at all. Now, can you imagine how fascinating that is? And some of the things are like, the breast milk contains things like prebiotics. So prebiotics are food for the gut microbiome. So the baby is getting ready. The baby's gut microbiome is getting ready to get the right kind of food. And as a specialist in functional medicine, nutritional medicine, one of my biggest interests is, of course, in food. So food has one of the highest impact on the gut microbiome. Medications, I will not go into details today because Debojyoti, you and I have done one video on that, if you remember. Exercise, sleep, stress, disease, all of these you're familiar with. However, the biggest question remains is how much of what can we, manipulate versus what are the beneficial effects that we can see. So geography, genes, age are not things that we can, manipulate in a major way. However, as you can see from this list, there are more things we can control than what we can't control. So Debojyoti, does that answer your question?
Yeah.
Okay, so next, what does the gut microbiome do for you? So one of the biggest ones, because everyone's very interested in the immune system now, so development and maintenance of the immune system is one of the biggest ones. So immunization, and that starts from actually before birth. And of course, like I talked about, C-section versus vaginal delivery. Now, I'm not saying that, people should not have a C-section. There's always a justifiable reason to have a C-section. But my point is, it does make a difference. The next thing is processing nutrients, which is actually so interesting. So, now Debojyoti, please correct me if I got the numbers wrong. What I understand is there are about 23 different enzymes which process carbohydrates, which come from the gut bacteria, right? We don't have them. We have less numbers. We have about 7 or 8. Am I right? So, what does
the number?
Yeah, anyway, bottom line is there are a whole bunch of carbohydrate processing enzymes which come from the gut microbes. So what it means for you in terms of, what is going to happen to your health is it will decide how much of the food you take is going to go into storage as, so for example, carbohydrate. Now, carbohydrate intake is very important for, particularly people from South Asia, because we are more prone to diabetes. We have a higher incidence of insulin resistance. So insulin resistance, in very simple terms, is basically a disruption of your carbohydrate insulin processing system, where a small amount of carbohydrate can give you a very abnormal response in terms of higher blood sugar, higher insulin levels, and a whole lot of stuff. So that is my very simplified way of explaining insulin resistance. It's much more complex than that. Bottom line, depending on how your gut microbiome behaves, it will decide how much of your food is going to go and increase your blood sugar. So a few years ago, there was a very interesting study which looked at the gut microbiome, blood markers, a whole lot of things, and they used machine learning to predict. So basically what it means is, now if I eat, maybe a banana, my blood sugar may go into the levels of that of diabetes, and I don't have diabetes, versus someone like Debojyoti may eat a banana and it doesn't spike his blood sugar at all. So this is the personalized blood sugar response we talk about, and the gut microbiome has a huge impact. However, that is not the only factor. There are other factors as well. Then comes, a lot of people are very interested in, how, so xenobiotics, or xeno essentially is foreign, biotics is substances. So things like medications, melamine, dioxin are two hormone disrupting chemicals. Dioxin is an estrogen mimicker. So basically, melamine is all those, cheap utensils you sometimes you're forced to use when you're eating from one of those street carts, which of course, because of the ongoing pandemic, probably you don't get access to. So these are substances that your liver has to process, and the gut microbiome is intimately involved in the processing. And Debojyoti, if you remember, you had talked about medication processing in, I think, that video we had done together, right?
Yes.
And how the response to a particular medicine is decided by the type of gut microbiome present.
Yes.
Then the other big thing is, thank you. The other big thing for me as a woman's doctor is estrogen metabolism, because how you metabolize estrogen will decide your risk for breast cancer. And in men, it would be, other things like prostate cancer. So estrogen metabolism in women, a big part of it is also decided by the gut microbiome. There are some specific microbiota present which will help process the estrogen in a certain way so that you don't make the harmful metabolites. And obviously the estrogen has to go out of the body. And this is the estrogen that you make in your body. Then vitamin synthesis, vitamins B, K, whole bunch of them. Neurotransmitters like GABA, dopamine, noradrenaline, acetylcholine, histamine. So basically we talk about the gut being the second brain. So the gut immune brain interaction is extremely important in the world of functional medicine, because so how we start off with treating anyone is first we focus on the gut. So unless the gut is healthy, trying to fix anything else is usually a much bigger problem. So when we say that the gut is the second brain, it doesn't mean it's the brain which is like the CEO of your, not the goal setting, impulse control part of brain, but it could be impacting your mood. And that's like a very big thing, because mood disorders are so common now in men as well as women. And particularly mood disorders in the young is something that has become much more common now. So this I've already finished. Now, what are the different ways of manipulating the gut microbiome? Food, as I said, is one of the biggest ones. Now, medications, back until a few years ago, we knew that antibiotics would, impact the gut microbiome, because antibiotics many of them are antibacterial. So obviously they're going to impact the bacteria. However, what is scary is the amount of antibiotics in animal feedlots. So this is commercially bred whether you talk about chicken or mutton or anything, and in countries like Canada, it's also beef and pork and all that. So one of the videos I quoted a study from India actually, where about 70% of the meat that they found, this was I think chicken, and they found that about 40% of that that meat was contaminated by antibiotics. And the scary thing is, some of these antibiotics are considered to be sort of like a last resort antibiotic. So these are the ones that, and the sad part is, this could be leading to all those super bugs that we hear about, the ones that are resistant to a whole bunch of antibiotics, and that's not a great thing to happen. The other big one is PPI. So PPIs are proton pump inhibitors. These are drugs like omeprazole, lansoprazole, a whole bunch of them, which some people take them as like, candy. It's like they are sort of them, I would say. So you don't need to do that, in the sense that, yes, it does impact your gut microbiome. And PPIs is again a different story altogether. It impacts long-term health. It increases your risk for death. Metformin, very commonly used in diabetes, in PCOS. So I'm not saying you should stop all your medications, but my point is, you have to keep all these things in context when you're looking at somebody's gut microbiome. Statin medications are cholesterol-lowering medications, blood pressure medications, antipsychotics. In fact, as Debojyoti had mentioned in the other video, many of these medicines, how well they act on you, is also decided by a large part on how your gut microbiome is. Then, of course, probiotics. I think, Debojyoti, we will talk a little bit about probiotics. And the fourth way of manipulating the gut microbiome is through fecal microbiota transplant. So essentially what I said before, and I know Debojyoti will have someone else talking about it in details. So essentially so FMT is an approved treatment modality for something called C. diff, so Clostridium difficile infection, which is a really horrible infection. You don't want it. But some studies done, I think it was in the University of Arizona a few years ago, they looked at children who were on the autism spectrum. So they gave them a FMT of children who did not have autism, who were not on the autism spectrum. And they found that the symptoms of autism were less in those who got the FMT. So that is again that is not an approved modality of treatment right now, but I'm sure in the future things are going to change. So I think, Debojyoti, that is all from me for now. And again, I'm happy to answer your questions. Yes, so basically, then going back to what I talk about gut microbiome when I'm talking to my patients is, it's not just what is there. So what are the different types of bacteria that are there? But it is also, who are their friends? Who are they talking to, chatting to? And what are they doing together? So basically, one type of bacteria can make a certain chemical, a metabolite, and that can help another type of bacteria do something else. And then, of course, everything interacts with your genes and your lifestyle. So it's one piece of the puzzle, and it's a very important piece of the puzzle, but it's not everything. That is my point. It's like, it's not the reductionist approach to medicine that we've been, you have high blood pressure, just take this pill and you'll be fine. No, there are a lot of other factors which impact that as well.
Correct. Yes. Thanks, Dr. Kerr. I mean, we've had a video together on gut microbiome, and we discussed a lot of things in detail in that video. But for the audience here, as Dr. Kerr was mentioning, the impact of the gut microbiota on medicine is something which is a new field, which is called pharmacomicrobiomics. And there are a lot of evidence now of how different medication affect the gut microbiota and vice versa. So as you had mentioned, metformin. So now metformin, people had shown that metformin actually increases a particular gut bacteria called Akkermansia mucinifera, and that is supposed to be a good bacteria. And whatever one of the benefits of metformin, the ways by which it produces that is attributed to Akkermansia mucinifera. And there are so many other evidences. One of the other things that you mentioned about the role of estrogen and all. Um, you know, the soy protein. There's a particular gut bacteria which converts the soy protein into something called as equol, which is
Yeah.
a analog of estrogen, and then it causes what it does. So yeah, so this is a very fascinating field. I mean, and we are just scratching the surface, isn't it, Dr. Kerr? There are so many aspects to it that for an individual researcher who is looking at the gut microbiota, it's not enough. I mean, you have to collaborate with machine learning experts, you have to collaborate with data scientists, you have to collaborate with clinicians, researchers, nutritionists, and then probably you'll try to understand what is happening inside the gut. So it is not only gut, wherever the microbiota is present on or inside our body. So going to the next part of my question, coming from whatever we were discussing and you presented, as a clinician, what kind of patients, when you see, you think that gut microbiota should be checked? What, of course, the usual suspects are people with intestinal disorders and stuff. But are there any other kind of patients where you think that the gut microbiota should be checked?
Thank you, Debojyoti. So before I answer your question about how we use gut microbiome testing, I just wanted to make a comment on your equal this thing. So interestingly, because soy doesn't behave the same way in everyone. So a few years ago, they'd done a study where they gave soy to predominantly Western population and the Japanese population. So it turns out that people in Southeast Asia, Japan and Korea and all these countries, they use soy a whole lot more, but the soy they use is not the processed soy milk and things like that. It is fermented soy, tempeh, tofu, those kind of stuff. So what they found is soy processing enzymes in the Japanese gut was different from what it was in American gut. So again, obviously the difference will result in end results as well. So is soy beneficial for you? That is again a question that can be answered when individually. There is no superfood for everyone, common superfood. So going on to your question, how we use gut microbiome testing. So there are two types of and again, like I don't know whether I mentioned before, the type of medicine we practice is what we call predictive personalized medicine and patient participatory. So you would think that every doctor would practice patient participatory medicine, but back when we were more used to the paternalistic way of dealing with, okay, you just take this medicine and you'll be fine. Now things are changing because patients, and again, if you and I are patients, we'd expect that too. The doctor needs to have a discussion with the patient that is this what you want to do? Is this what you're open to doing? Are you open to making these changes? So there are two types of ways in which patients come to us with a gut microbiome report. One is the ones who are, we call them the biohacker community, so to say. They like to know more about their own health. So they may have come across an advertisement for a gut microbiome test, and they get the test done, and then starts their frustration because they go to their regular doctor, and the regular doctor obviously doesn't have time to go through a gut microbiome report. So a few years ago, I remember a patient had come to our office in Calgary, and she came with a report from one company here. So she came with a whole bunch of printouts and everything. And so she said, "Doctor, there is this test that I have done." And she was like very defensive about. I said, "Yeah, what is the name of the test?" So I said, "Oh, that's fantastic. So you did a gut microbiome testing. So what are the things you found out?" She was surprised that, I was talking about that versus, because when she went to her family doctor said, these tests they are not valid, and, they are not, because obviously they have not come into traditional clinical practice yet, but that is going to change. So that is one where the patient themselves do the test and then they come to us. Then we ask them, so what would you like to do? Did you follow the, whatever food they said, these were bad for you, these are good for you, these are neutral for you? Have you followed that diet advice, and what difference did you see? Because we can see the biomarkers, the blood test reports before and after. So this is the other point I want to stress upon, is doing a gut microbiome test just once is not going to be enough. You need to see, as I tell my patients, you don't need a screenshot, you need a video. So a screenshot will only give you the picture of that point in time. And the gut microbiome can change in as little as 2 to 3 days if you eat something different, based on the kind of food you're eating and all these other influences. So doing a gut microbiome test just once is not going to give us, number one, adequate information. And you need to see, what is happening. So let us say, so what we tell them is, if you are, happy following the diet protocol that they have recommended, definitely go ahead and, do that. In 3 months, we will see what happens. Because again, in 1 month, we don't expect something dramatic to happen. A lot of the things take time to change. So ideally, again, why 3 months? I don't think we have studies to show whether, yes, we would probably love to do a gut microbiome check every day, but I don't think that's really possible right now. So yes, so before and after is the other thing. And the second area, which is what we are exploring more now, is patients who have not just gut symptoms. So I'm not talking about, inflammatory bowel disease or IBS or any of that. These are patients who come to us, and we've been trying to do fix. Obviously, we always start with the gut first. So we are trying to fix their gut, but we find that their inflammation levels. So one biomarker is a blood test is HSCRP, so C-reactive protein. So we find that their HSCRP has remained high despite all the dietary changes we've asked them to make. So diet has a huge impact on chronic inflammation levels in the body. So obviously, if we have, ruled out the usual culprits and, all those things, because why are we focusing on chronic inflammation? Higher levels of chronic inflammation are related to 95% of human disease. Whether you talk about heart disease, stroke, dementia, mood disorders, obviously gut issues, all of those are related to chronic inflammation. So let us say we have, done the basic stuff, made them go through what we call an elimination diet. So they take out the usual suspects. In North America, most of the ones are gluten, dairy, soy, corn, processed food, sugar. These are the big ones. These we can ask people to eliminate even if they haven't tested. And the other thing is, a gut microbiome test will not tell us whether a person is gluten sensitive. So let us say we've done the basic stuff, but the patient is either still not feeling well, or the inflammation levels have still remained high, or they have continued to have gut issues, and we have ruled out the major diseases. That is one of the important things. Like supposing the patient comes to us and says he or she has bleeding in the stool, obviously we are going to rule out the major ones first. So then what has happened is, this was very interesting. So two of our patients, one patient was, we went through the usual elimination diet and everything, and we didn't find anything. He was a very good patient, so which means that he followed our advice. Well, there's nothing good or bad about that. It's just that people are different. So he went through all that. And then what we said, okay, are you open to doing this? Because sometimes patients will tell us, "Doctor, do you think I should do a gut microbiome test?" I said, yeah, if you want to, definitely we can help you process the recommendations, but it's up to you. If you want to do it, yes, please go ahead and do one. So what he found is that, and again, I don't remember the names, there was one particular metabolite which was higher in him, which was, making him more inflamed. So once he eliminated that, his CRP level started coming down. There was another gentleman, very healthy, fit, he was about 52 or so, very much into fitness. I think he was into He was into cycling. Yeah, he used to cycle every day, and the winter, I forget what he did. So again, same thing with him. What we found is it was some particular thing in relation to red meat consumption, which was actually getting in his way. So once he removed that, so that these were like some of the major ones that we really found them very 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 helpful. Another thing is sometimes the dietary recommendations, do we always follow exactly what the company says? Not always, because what happens is we also look at their blood work. And for instance, if let's say the report says that they need to be on 200 grams of carbohydrates a day, and I can see that their blood sugar is really high, not diabetic yet, but it is trending up, then we are going to say no, 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 no. That is probably not the right recommendation for you. So let us set that aside, and do follow the other stuff. So it's like different ways of how to take care of a report. Most of the time, Debojyoti, what we found is, one is people feel that they don't have adequate information on how to process their report because they don't have someone helping them guide that journey. And the second thing is they need hand holding when they're making those changes. So those are the two major insights that we have got from our journey of using gut microbiome reports.
Yeah, Dr. Kar, I'll talk about our experience, Bugspeaks, which is South Asia's first gut microbiome test. We've had, very interesting cases where, one of the cases where we found that the intestine had a very large proportion of bacteriophages. Now, of course, there was no clinical evidence to suggest anything on that. So we didn't recommend anything, or we just left it at that. But the fact that a particular patient has a particular bacteriophage going very high, which is more than the usual, points to certain things which probably we do not know yet. But as we move on, more research, more clinical studies will shed a light on that. Similarly, we had a patient who had very high fungal load.
Okay, sorry.
No problem. So we had a patient who had a very high fungal load, again in the intestine, as compared to the normal average Bugspeaks user. Again, we left it to the treating clinician to take care of that, because we can't suggest anything. So those are the very interesting cases where we found people to have certain things which are out of the normal. In many of the cases, we do not have evidence to suggest anything, any clinical kind of suggestion. But these are very interesting subjects to look deep into. Coming to your point of the dietary recommendation, at least in our case, and I think in most of the microbiome companies' cases as well. So we look at the role of the microflora, and we do not look at the background information of that individual. So, for example, the person might be diabetic, but in that particular patient, we find a certain bacteria which probably requires a banana to be fed. Just an example. So we will say that you should consume banana because a particular good bacteria is lacking in your intestine, and earlier evidence have shown that feeding banana with all its nutrients will increase its level. So we recommend taking banana. But if that person has diabetes and any other clinical manifestation, then of course he or she has to take, as you said, that into consideration before completely following the recommendation. So yeah, thanks for bringing those points, Dr. Kurt. I think that's very important for all microbiome reports and people handling those reports. Another point which you rightly pointed out was, how the end user, the patient, if it's a doctor who has recommended the test, then it's fine because the report goes to the doctor looks at it, or the nutritionist looks at it, and then does the next best thing for the patient. But if it is the patient or the end user who would have read somewhere about the gut microbiome, and he's hit the roadblock, so to speak, and then when they do this test, I have seen in many cases where people struggle because when they go to their regular physician, they will just give a sachet of Visilac, and that doesn't work, right? I mean, because it's a very complicated thing, and that's one of the reasons why, if you see in our website also, we have something called as our experts, where we are trying to build a community, so the end user can, select uh, the nutritionist or the clinician who understand this space and can then get in touch with that particular expert. So, thank you, Dr. Kar. I just wanted to ask another question, because we are talking about the microbiome report and everything.
Before you move to the next question and I lose my chain of thought, let me just address your fungus and your bacteriophage question. Yes, both of those things, I don't know what it would imply. But one thing is for sure, any disease it's not like, for example, I'll give the example of diabetes. It's not like, today you don't have diabetes and tomorrow your blood sugar, I don't mean you, I mean anyone. Tomorrow your blood sugar crosses a certain level and you have diabetes and your doctor says you need to start metformin or you need to start this medication. It's a continuum. So obviously the bacteriophage and the fungal growth that you're noticing, which is not showing symptoms today. And again, as a functional medicine doctor, I would say I am sure there are some predictive biomarkers there. If anyone like me, a functional medicine doctor, digs deep, we will find it. So right now that is one thing we don't know what each of these things imply. The second thing we don't know is just because something is present, is it harmful? So when you talk about, and you are talking about fungal growth in the large gut. Now there is an entity called small intestinal fungal overgrowth. So obviously a gut microbiome, a poop test will not reach the small intestine. That has to be a biopsy. And that's not recommended for everyone. So is it possible that there is something called a large intestinal fungal overgrowth also? I don't know about that. But my basic, this thing is watch this space, because obviously things are going to develop. And the other big area where we don't have adequate information is, see, India is a country of 1.3 billion people. We need more people to do their gut microbiome test, because we don't have the basic, the baseline for people from India. So what happens in, let us say, a predominantly Western population, we cannot always extrapolate that to what it means in India. Because as you know, there have been so many studies where they looked at the gut microbiome of, more traditional societies like I think the Hunza in Africa, where they had certain bacteria which we would think would be harmful, but it was not causing any problems in them. So my recommendation would be, if there was one message I would like to give across to everyone is, we need more Indian data. So definitely, and Debojyoti is not paying me to speak. So it's not, I'm not promoting them or anything like that, but we need more Indian data, number one. Number two, if you're a clinician or a researcher, definitely we need more research. I mean, that goes beyond saying anything. And if you are an investor or somebody who would love to invest in research, yes, this is one of the areas that needs a lot of funding. So those would be. But the other thing, unfortunately, Debojyoti, which I've been trying to, I speak at a lot of medical events and all that. I've been trying to bring about awareness. So this was a few years ago. I had an experience. I was speaking to a group of doctors in Mumbai. So I asked, how many of you have never heard of the gut microbiome? I was shocked to see the number of hands raised. I hope that has changed now. Okay, so going on to your next question.
Yeah, so you've given me a lot of food for thought. We deal with a lot of doctors in India, and there's a lot of skepticism. One mainly because in India, there's a lot of inertia on anything which is very new. And if something is very successful in the West, people will be very happy to adopt it in India. But if it is something which is very new, which someone like us trying to do, they will like to get these things validated in the West and then probably adopt it. So I find a lot of inertia here, but that is true. My question to you was mainly, what, as a clinician, what would you like to see in a gut microbiome report? What would you see which will help you more in addressing the issues of your patients?
Thank you. That is something. It's more futuristic because it's not. We are not there yet today, but that this is the path. So what we would our dream as functional med or any doctors for that matter is we should be able to study the gut microbiome and come up with a recommendation. Number one, with food, which correlates to the blood markers, like you said about diabetes and these things. And the second thing is, this is again another dream which will, I don't even know whether we will realize that ever, is to have a probiotic recommendation which is specific to that person. So just about probiotics, I'll say a few things. Because sometimes what happens, Debojyoti, is, again, this is the way traditional Western medicine has been working is, this problem, one drug. So a lot of people think, oh, there is dysbiosis, just give a probiotic. It's not as simple as that. Number one is, what is the type of probiotic that you're giving? So some of the so in countries like Canada and a lot of countries, they have certain specifications. So for example, for any product to be called a probiotic, which has health benefits, it has to have a certain number of colony forming units. So I think it's 10 to the power 9 colony forming units, so CFU. So when you look at that, the probiotic that you're using, look, number one, for that. What is the colony forming unit? Most of our patients don't do, and it doesn't show much effect at anything less than 30, 50, 100 billion colony forming units. If it is something like, let us say, someone who has inflammatory bowel disease, they will not respond to just a 5 colony forming unit probiotic. You'll need a higher dose, number one. Number two is, what are the different types of bacterial genera in that? Like, what are the different genus and what made them decide that this particular one should be there? Third thing is, of course, shelf life. Because probiotics, some of them, the really high quality ones, they have to be kept in the fridge because they may not be stable on room temperature. So yes, Debojyoti, in the ideal world, which I hope will happen soon, we will be able to check the gut microbiome and say that these are the food which is already happening, but it's not completely validated yet. And particularly in the Indian population, it needs to be validated. We cannot follow, studies in some other country all the time. It doesn't, it's very different. And then what will happen is, again, these will be customized probiotics created based on their gut microbiome. And the other thing I think which will happen is, frequently providing a stool sample for a test is not very exciting. I don't know what others think, but so maybe we'll have something, maybe that'll be like a small device which stays in the gut, which can sense all these things. And then it can give data to maybe a smartphone or something, which can tell you, this is happening in your gut. Don't eat this, this is bad for you. So they'll get more information in real time. But of course, all of this is futuristic. This is what I'd love to happen.
No, absolutely. I mean, again, taking a cue from what you said about probiotics, it's not only about, even the genus and the species, it's also about the strain, because the same species, but different strains can work differently. And also, as you rightly said, I mean, I've had patients, calling us and saying that, I had a very upset stomach, or I was suffering from, IBS kind of symptoms, and my doctor gave me a bunch of probiotics. I took the probiotics and I became even more sick. So, it is a very complicated. So unless you know what is happening in your intestine, it's like taking antibiotics, broad spectrum antibiotics. You take it, and you feel that the bad guys will be taken care of with that antibiotic. So, yeah, so it's probiotics. So is where you would be personalized. In fact, the handicap of doing something in India is tremendous. But at the same time, we are working on those aspects, and hopefully, we should be able to provide personalized probiotics to the patients who will be taking our test in near future. So yeah, so that is very interesting. I mean,
to that. Debojyoti, I think your audio was a little disturbed sometime back, so maybe you just want to repeat what you said already.
Yeah, I was saying that we are working on this personalized probiotics part, and hopefully in near future we'll be able to bring that to India. So let's see. So that is something which we are also very excited about. So Dr. Kar, another aspect which I think should be discussed with you, because you are a clinician, is that gut microbiota test as a non-invasive prediction of diseases like IBD and autism and NFLD. What do you think are the challenges in this particular aspect?
Oh, thank you. There was a fantastic. So you mentioned NAFL, so that is non-alcoholic fatty liver disease. So NASH is NASH and NAFL, basically fatty liver in common terms. It is like an epidemic now. And very interesting that you brought up fatty liver, and I'll just say fatty liver instead of confusing it with NAFL, NASH, and all that. So fatty liver is a condition which is related to insulin resistance, being pre-diabetic. And worldwide, it is becoming like an epidemic. And very soon, the unfortunate consequences of that is those who have the inflammatory one, the steatohepatitis, sorry about the long sounding medical terms, the steatohepatitis, those who progress into that, they may develop cirrhosis and a liver failure and finally need a liver transplant. So obviously, our goal is to stop that from happening. And as you rightly pointed out, see, steatohepatitis cannot be confirmed without an invasive test and doing a liver biopsy, or again, some ultrasounds are there now, which are so we are always looking for non-invasive ways. So non-invasive meaning you don't have to poke and don't have to give injections, you don't have to put them under anesthesia. So a poop test is very non-invasive. So in NASH NAFLD world, they have seen that the gut microbiome, again, like I keep saying, one single test will not tell us anything. It has to be tested over a period of time. They've shown that the change in the gut microbiome composition can predict the progression in NASH NAFLD. So that is huge. I mean, we are always looking for predictive, preventive biomarkers. So that would be a very big area. Then again, like, you brought up IBD. So inflammatory bowel disease like ulcerative colitis, Crohn's. They have new studies have come up which show that, that depending on what the type of gut microbiome is, your response to a particular drug can be decided based on that. So those are the two. I think it has a huge. I mean, it's going to have a huge impact definitely in the future, and I'm sure in a few years this will become like a norm, like how we do a fasting blood sugar and hemoglobin A1C and all these things. It will become as common as that.
You're right. I mean, when HbA1c initially came in, the cost factor was quite a important decision making objective for a lot of people. But now it has become the norm. So I think gut microbiome test also will become the norm. And specifically because the cost of NGS or the next generation sequencing is also falling down dramatically. So I think it will be really affordable for a lot of people in times to come. And there are so many domains that gut microbiota has links to, like gastroenterology. You talk about oncology. You talk about mental health. You talk about gynecology, pediatrics. Every domain has some sort of link to the gut microbiome. So I think that is going to be the future. That's what the hope is. But let's see how future comes to, or how this particular domain shapes up. So one of my last
one comment before I move ahead on hemoglobin A1C, because everyone does it now. So in South Asians, hemoglobin A1C may not be the best marker of blood sugar because it changes based on if someone has iron deficiency anemia, which is very common in men as well as women in India. It can show a false report. And in South Asians, I think there are a few studies from Singapore where it shows. So this thing is we don't rely on the hemoglobin A1C all the time. You need to do a fasting and post-meal blood sugar as well. That's just an aside. Go ahead.
Sure. Yeah, one of my last questions to you, Dr. Kar. Any message for people in India, clinicians, researchers, general public?
So I'll just repeat myself. Like I said, you need data from India. So definitely get your personal gut microbiome tested. I'm talking to whoever's listening to us. And the other thing is not just once, you need to do it more than. So I think most of the studies where they're doing a longitudinal study, they're doing a gut microbiome test every 3 months. Am I right?
Yes.
Yeah.
Yes.
So that is
Most of
something
the
I would recommend. And if you are a researcher, I mean, find an area which is going to have an impact. Like Nash NAFLD is one of the biggest areas where in India it's scary actually, if you tell me. Another big area is mental health. These are two areas, but the fact is sometimes this is from based on my conversation with a lot of researchers. I find that sometimes researchers are so much in their academic world that they forget what context their research has in the real world. So I would suggest that if you are a clinician and you are not a researcher like me, I'm not a researcher, I'm a clinician. You need to collaborate with researchers so that it can make sense, relevance, rather than saying, oh, gut microbiome report is like, it doesn't mean anything. So that just shows ignorance, nothing else. So why not change that? Why not collaborate with researchers like you all to find out what does it mean for people in India? So those are my two. And like I said, if you have money to invest and you want to do something for your country and you want to, I would definitely recommend. Science needs a lot of money.
Absolutely. I will rather tell everyone, whoever is attending this session, and to whoever is looking at it on our live stream, that research, um, what we call in pharma bench to bedside. It's a long process, and unless there is active collaboration between academia and industry, this process is going to get even longer, because we don't understand life that well. When I say life, not in a philosophical manner, but even how medicine works. So it's a long journey, and we need much more collaborations between everyone to come up with solutions, because solutions are important. Otherwise, what COVID has shown, isn't it, Dr. Kar, that we were underprepared. We didn't. We took everything very lightly, and a small virus has changed the way we look at
Yeah.
ourselves. So yeah. So I would.
And another thing that I wanted to talk about is, see, either we can wait for someone to take it up and do, or we can also look at doing citizen science projects.
Yeah.
Each individual contributes something from them, either their sample, their knowledge, their time, and all that. So citizen science project, I think, is the way that a lot of research projects will be done in the future. So sorry,
Absolutely.
go ahead. That was my
So
third recommendation.
I think we have come to the end of this session, and I will be very happy to take questions from the attendees. I think we have one question. It's from Eli Arsita. She asks, "What do you think about kombucha, fermented tea with
Okay.
symbiotic culture of bacteria and yeast?" Your take, Dr. Kar.
Okay. So about all fermented food, whether it is kombucha, sauerkraut, or any. By the way, chocolate is a fermented food without the sugar. So for any of those, see, as Debojyoti and I were talking about the soy processing enzymes in the Japanese gut. So most of these are, for example, kombucha. Now, if you are from a traditionally kombucha eating background, then definitely it will have a very different response in you versus someone like me or Debojyoti, who we don't come from a traditional kombucha eating world. So my point is, maybe once in a while, if you have it and you see that there is benefits, go ahead. At this point in time, I don't think we have studies where, see, what happens, Debojyoti, sometimes is some people think this is good, so they feel that they need to overdose on it. So maybe don't overdose. But in our world, we always say when something is uncertain, always test, treat, and repeat. Test, treat, and repeat. So you can do what we call N of 1 test. So if you are somebody who wants to try out kombucha, go ahead and try. And again, be very careful with the quality, because kombucha can come, in a bottle with a lot of other stuff that you don't want to be eating. Similarly, the same recommendation I'd have for sauerkraut, for any of this, kefir or whatever. By the way, yogurt or the dahi that we are used to, that is not a probiotic unless the manufacturer has added probiotics to it. So, does that answer your question?
I guess so. I hope that answers that question. I'll add one small point to this. And you mentioned that in one of your earlier session points that the storage conditions of these fermented products is very important, because if you go to Amazon, you will see a lot of kefir, lot of kombucha available. By the time it
Yeah.
reaches you, and if it is not properly stored or transported, you might not be getting what is recommended dosage of probiotics, which is there in that particular thing. So it is very important to understand these small nuances, and then take this probiotics. So this session is open to questions. So if there are any questions, please feel free to put it across, and we'll be happy to take them. Okay.
Do we have any
So
questions?
I don't see any more questions. So with that, this session comes to an end. I thank Dr. Kerr immensely for taking her time out and discussing this very important aspect of gut microbiome in clinical practice. Functional medicine itself is a very interesting concept. Not many people understand it, but I personally understand or like the concept, because you are looking at the disease in a very holistic manner. You're not just treating the symptoms, you're trying to treat the cause of the disease. And when you're looking at the cause, gut microbiome, oral microbiome, and there are so many other biomarkers which a general physician or clinicians would not even know, play a very important part. So in that sense, functional medicine is really interesting. And as I said, I thank you, Dr. Kerr, for taking your time and sharing your insights. And I thank all the attendees for attending this session. I hope you had you liked this session, and we hope to see you in our next episode. So bye for now.
Thank
I'll
you,
be there.
everybody. Thank you very much.
Thank you. I'll be there on the lounge. If you want
Okay.
to network with me, I'll be there. And Dr. Kerr, feel free to be there on the lounge as well. Uh, we
Okay.
we can network with people if they wish. Okay.
Oh, okay.
Bye.
So I just go to the sessions.
Yeah, you can go to the lounge and see if there are people who want to talk to you.
Okay. I'm trying to
Okay.
figure out how I can go to the lounge.